Welcome friends to CNS Viewpoint. Today again we are back at 5 p.m. India time with our thoughts and views and perspectives on something that made us think. Today is one of the days of World Antimicrobial Awareness Week, which is being observed by World Health Organization, which is United Nations Health Agency, and United Nations Food and Agriculture Organization (FAO), and World Organization on Animal Health, which is another important agency, and United Nations Environment Program. All these four have combined together along with several other agencies, research institutions, organizations, individuals around the world to observe 18 to 24 of November 2021 as World Antimicrobial Awareness Week. WHO along with the FAO and OIE, which is World Organization of Animal Health, has been observing World Antimicrobial Awareness Week in November since some years now. I think 2015 onwards. I could be wrong, please check. So friends, this year's theme is raise awareness, stop resistance. Antimicrobial resistance is when bacteria, virus, fungi or parasites become ineffective. They develop resistance, they go through changes that make them ineffective against these diseases. Now with drug resistant infections, the treatment becomes more difficult, could become more lengthy. Treatment options are severely limited, and treatment outcomes are also often very bad or not satisfactory, and risk of dying is also much higher for drug resistant infection. So first of all, let me vent out because one thought has been hovering within me since some time, and that is there should not be a single case of at least single case of drug resistant tuberculosis where the drug resistance happened because of irresponsible and inappropriate use of medicines. There should not be a single case of such kind of drug resistant tuberculosis. We know infection control measures, what works, what does not work. We know what is rational use of drugs, what is responsible and appropriate use of drugs. We know all the standard therapies. We know how to diagnose, drug resistant strains or do the drug susceptibility testing. We have laboratories in many places, although they might be lacking, and this is not a new knowledge. This has been here. We have had access to these laboratories, diagnostics, treatments since a long time. But since quite a while, since years. But if you look at number of drug-resistant tuberculosis cases estimated and laboratory confirmed in 2020, 2019, 2018, 2017, 2016, etc. And likewise, all the data is in public domain on the WHO website. You will find, friends, that there is barely any decline in patients of drug-resistant tuberculosis, and all the struggle is, is to put people on treatment, diagnosis and treatment, but which is of course true. But the very sad and deeply sad reality is that, if I remember correctly, a very small percentage of, I think, 1/3 or less than 1/3 of people who have had the drug-resistant tuberculosis got treatment, I think. So, and these figures can vary from place to place, but by and large, the 500,000 new cases of drug-resistant tuberculosis is no small, blunder. And if it is a man-made disaster, which it is, The WHO itself had said almost 15-20 years ago that drug-resistant TB is a man-made disaster. Then this is high time that we address this. This is high time we ask a difficult question: why are we not able to prevent transmission of drug-resistant tuberculosis strain of bacteria, the infection? Why are we failing that it gets transmitted from person A who has the bacteria to person B? Number two, why are we failing that people who have latent tuberculosis, including latent drug-resistant tuberculosis, why is it converting into active TB disease, active drug-resistant tuberculosis disease? Why are we not able to, for example, do more on tobacco control or end tobacco and alcohol use, or diabetes management, for example, can be another risk factor, HIV, etc. We know how to prevent HIV. Antiretroviral therapy, for example, for a change, is one of the ways to ensure that treatment is prevention. And of course, there is a whole bunch of combination prevention options which must be fully leveraged to ensure there is zero transmission of HIV, as well as everyone who is living with HIV has access to treatment and remains virally suppressed. Same goes for drug-resistant malaria. For years, drug-resistant malaria has been a major concern in Greater Mekong sub-region, but now, friends, was very sad to read that drug-resistant malaria has also been found in Rwanda, in Africa. Rwanda boasts of one country in Africa, high regard to the kind of the people of Rwanda to put up a commendable health system and other social systems in place despite a very troublesome past. Those of us who have been to Rwanda and have seen the memorial, they will probably relate to, as an outsider, what people of Rwanda have gone through, and the kind of resilience which they have demonstrated to rebuild the nation to this point. So I just wanted to say this because if diagnosing drug-resistant malaria in Rwanda could also be because it had better diagnostics. I don't know. Maybe other countries may also be doing drug-resistant malaria. I have no clue about that. But that is just my worry. I'm just loud thinking. Maybe I'm irresponsibly thinking right now. But I had to say this. So anyways, coming back to antimicrobial resistance. So the most important thing here is the One Health approach, friends. It is the health has always been, not in silos. It was not about an isolated vertical intervention for health, but it was always about an integrated health response which goes along with social security, which goes along with so many other rights-based approaches to ensure that everyone is able to live in a socially just and ecologically sustainable manner. That is what was important, and that is what is important. So One Health approach is so important, and antimicrobial resistance is another slap on our face, because it is again reminding us that we are forgetting the basic lessons. We are not doing One Health approach. We are not ensuring that what we are doing. All actions across the spectrum are ecologically sustainable and socially just. So antimicrobial resistance happens because of irresponsible and inappropriate use of medicines, but it also happens because of irresponsible and inappropriate use of medicines in other sectors other than human health. For example, in plant health, in agriculture, or in animal health, in veterinary, or and how these microbes, not microbes, these drug-resistant microbes seep into our environment. For example, into our rivers from the effluents which are coming out from polluted, from the effluents from either from the hospital. It could be a hospital, or it could be where plant processing is happening, or veterinary or animal related center. So these the antimicrobial resistance also happens because of that, and there's a huge risk, and it's a real risk, and it's happening already. And that is the reason why United Nations Environment Program joined forces with World Health Organization, with the World Organization on Animal Health, with Food and Agriculture Organization, and these four now are spearheading a global response to antimicrobial resistance, and as well as hosting the World Antimicrobial Resistance Awareness Week. So please use drugs, medicines responsibly and appropriately. Please spread the message that no one should be using medicines irresponsibly or inappropriately, either in human health or plant health or in animals or veterinary for selfish gains. And please ensure that we do not pollute the planet, the only planet we have to live. We do not have a planet B. We do not have a plan B also when the drugs stop working and diseases become incurable. So let us rise to the occasion. And the message on World Antimicrobial Awareness Week is spread awareness and stop resistance. Use medicines responsibly and appropriately. Take care. Let us do our 2 bits, please rise up. It's about you, it's about me, it's about our loved ones, it's about the planet, it's about all of us. No time to die. Take care. Bye-bye.